The National Institute for Communicable Diseases has warned that malaria is being confused for COVID-19. In a statement issued yesterday, the NICD said the misdiagnosis is happening because the condition shares some common symptoms. If left untreated, patients with malaria could experience life-threatening complications. Well, to discuss their findings, Dr Jaishree Raman joins us now via Zoom. Doctor, thank you so much. You're a senior medical scientist at the NICD. The symptoms are very similar. How did you make the connection that there was a misdiagnosis going on?
So basically, we got some information from our teams that are working in the field and having a look at the number of cases and people that are coming in late for diagnosis or getting very, very ill. And then we're just noticing that there's this delay in diagnosing of malaria because people are considering COVID first before considering malaria at all.
Doctor, what are some of the common symptoms?
So basically, it really is just the normal non-specific fever, flu-like illness, fatigue, nausea, headache. So it's really very much the common symptoms that everybody's associated with COVID-19, which is really resulting in people not thinking of malaria at all.
It's really, malaria in South Africa is prevalent in particular districts. Which are they, or which particular provinces, and what can healthcare workers and community members at large actually do to make sure that they do get the right diagnosis?
So, yeah, you're very right. Malaria is restricted to very few areas in South Africa. So it's the northern parts of Limpopo, Mpumalanga and KwaZulu-Natal, which really share borders with our neighboring countries, Mozambique, Zimbabwe, Eswatini and Botswana. And people need to just be very aware that malaria is a risk in these areas, and healthcare professionals that know the people that live in these areas or that have traveled to these areas or malaria risk areas should consider doing a malaria test and COVID test if a patient is presenting with fever or flu-like illness.
How was this actually picked up, and were any deaths, experienced as a result of misdiagnosis?
Unfortunately, that was really what sparked the concern. We started hearing of a few deaths that occurred in KwaZulu-Natal and in Mpumalanga, and some investigation has resulted in us identifying that it was late malaria diagnosis that unfortunately led to these unfortunate deaths. So that's what caused us to release this alert, to make sure that healthcare professionals and patients would realize that fever is not only COVID, but it could possibly be malaria.
Doctor, before you go, very quickly, what other communicable diseases that you've been dealing with pre-COVID, what's happened to them? Are they still around, or are we just not talking about them anymore?
Oh, they definitely are very much around. Quite a few of them are on much lower numbers, but they are still around. But there's been so much focus on COVID that a number of diseases have not had the airtime that they do deserve. So we definitely still do have HIV, TB, pneumonia, and lots of other diseases, and of course malaria, that are still very much around.
All right, thank you so much. That was the NICD's Dr Jaishree Raman.